This is Chicago's very own WGN News at 6.
There are changes in the drug world by the Trump administration. The Department of Justice is reclassifying medical marijuana, and today the FDA announced it will fast-track reviews of 3 psychedelic drugs. Rachel Hoopsick is a professor of health and kinesiology at University of Illinois. She joins us now to talk more about the potential benefits and the downfalls. Thanks for joining us.
Yes, hello, thank you.
When you hear psychedelic, at least for me, it's jarring. It takes me back to the 60s when people were dropping acid and, these mood-altering drugs back at Haight-Ashbury. Should we be concerned about this? Or what are the benefits of fast-tracking this through?
There definitely is still some stigma around, the word psychedelic, right? So a lot of times when people hear that word, they only think about illicit drug use and not medicine. But we are understanding now that psychedelics are worth taking seriously. There is real promise there, especially for people with severe depression, PTSD, and other conditions where existing treatments do not work well enough. So,
and there's some also for alcoholism, right?
Yes. And so the main thing right now with this order is what it does is it tells the federal government to move psychedelics higher up on the priority list. So it pushes the federal Food and Drug Administration, the Drug Enforcement Agency, and the Department of Health and Human Services to speed up review, support research, and create a pathway for some patients.
But why now? I mean, they've been around for a long, long time, but why now?
Well, I think it signals that psychedelics have moved into the mainstream medical conversation. I think that matters, but this is really still just the beginning of a process, not the end of one. We have a lot of people with serious mental health conditions who are not getting enough relief from the treatments that we already have. And so if psychedelics can help even some of those patients, that is a big deal. But the caution is that we still need strong evidence about who they help, how they should be used, and what those risks are. So while this could make research move much faster, it should make us take some pause about how rigorous our research should be around these drugs. So we still need to take our time around this.
Right. It seems like these should be really regulated. I mean, we're coming off of a time when opioid addiction is such a big deal. And then this could be a part of the mainstream. And then we could have all sorts of problems, couldn't we?
Well, I don't want to, put a worry here. We need to study these drugs. We also need to make sure we're not overselling them.
Gotcha.
We don't want to get ahead of the evidence, right? If we get ahead of the evidence, we risk hurting patients and undermining trust in a field that may genuinely have value.
What about?
But I also think it's.
I'm sorry. Go ahead. No, go ahead.
I think it's fair to ask whether pushing psychedelics to the front of the line puts pressure on FDA resources and on the review process more broadly.
Gotcha. What about reclassifying marijuana? Who benefits from this? Is it medical? People who need it for medical reasons?
Primarily. So what we're seeing is rescheduling from Schedule 1 to Schedule 3. So Schedule 1, this is reserved under the Drug Enforcement Agency for substances that are of high abuse potential with no legitimate medical purposes. And so the move to Schedule 3 is now our federal government recognizing that cannabis has legitimate medical purposes, which is correct. But it's important to understand that rescheduling in this way does not remove marijuana from the Controlled Substances Act, so it still is federally illegal. And so who I think really wins here is licensed cannabis retailers. So rescheduling offers major financial relief to cannabis businesses, particularly by removing tax burdens that have limited profitability for state licensed operators.
Rachel, thank you so much for joining us today and kind of clearing that up a little bit.
Thank you for having me.